Hi, I'm Dr. Kivett, a board-certified plastic surgeon and dermatologist in Santa Rosa, California. And I'd like to speak to you today about the instructions that we give patients perioperatively, meaning both before and after the surgery. Normally, these are standard kinds of requirements, and it's of some value to patients. First of all, as we get you ready for a surgical procedure, medium or large or small, we like to have certain things in place so that you'll heal more readily and so that you'll have less potential for infection. So after we take a thorough history and determine that you're a reasonable candidate for surgery, then we start looking at other factors that could make a difference. I can tell you that it's important that you have plenty of rest, that you continue the medications that you've already identified for us, and in doing so, we can do a better job for you and know how to adapt to any problems that we may have before, during, or after the surgery. It's important that you have all of your tissues ready to be healing, and that's done with the usage of more protein than you would normally eat. If you can possibly be taking vitamin C up to about 2,000 milligrams a day, which is 500 milligram tablets, that helps. Any form of zinc is also helpful, and all of these things can be obtained without a prescription at a local pharmacy or regular store. If you can hold off on alcohol intake for at least a week or so before the surgery, that's going to help a lot because alcohol dilates your blood vessels. That also affects your clotting elements and your liver, and so it's a nice thing to do. There are certain medications that we'd like to have you not take. Again, it depends on what you're taking them for. If you're an older patient and you're at higher risk of having clots or some other problem for which you're taking aspirin, for example, then don't change what you're doing, but just make sure that we know ahead of time every single thing that you're taking, whether prescription or not. On some occasions, patients who take purposeful blood thinners to help with clots in their legs, clots in their heart, stroke prevention, and so forth, may offer to go off of blood thinners. It's important that we jointly, as doctor and patient, together make that decision. So don't just do it on your own. We may even need to talk to your family physician as well to determine if it would be a good idea to stay on the medicine or not. Other things that will help you are if you're a smoker, if you could possibly drop down your smoking to a zero level or something close to zero for at least a full week before the operation or more, that's going to help. We're not trying to get you to stop smoking generally, but we are, for this operative intervention, putting you at certain risk at this time in your life. It is a reasonable recommendation, and we hope you won't ignore that. If you make sure that you have no infections anywhere in or on your body, that's helpful. So if we're, say, operating on your face or a hand, and you have an infection in your foot that you haven't told us about and that we haven't discovered on examination, then sometimes it's possible to get infections from one part of your body into another part, including the place where we operate. And so that'll be very important to avoid in this situation. Sometimes we'll even prescribe antibiotics ahead of time because some people have artificial joints or they have heart murmurs for which they're trying to always prevent infections. And frequently we ask the patient, does your dentist require that you be on antibiotics at the time of dental care? And if the answer is yes, then you might be able to assume that we're going to also request that you be on antibiotics prior to the start of our operation. Certain medications that are over the counter, such as garlic, ginkgo, ginger, and ginseng, the 4 Gs, garlic, ginkgo, ginger, and ginseng, will dilate your blood vessels and make you want to ooze blood a little more than we would like to have. So if you can hold off on those for a few days as well, that makes a difference. Other medications that make a difference sometimes are ibuprofen, Motrin, Advil, all basically the same drug in the class of non-steroidal anti-inflammatory drugs. If you have any problems ahead of time, please call us, whether it seems inconvenient or not, to us, so that we can answer those questions. As far as postoperatively, the most important things you can do are to cleanse the wound at a time that we normally indicate, which in most cases are going to be at 3 days postoperatively. In other words, if your operation ends on a Tuesday at 4 in the afternoon, then 3 days postoperatively is Wednesday, Thursday, Friday, and then you can go ahead and start to wash the wound on Saturday. When you go to wash the wound, make sure up to that time the area has stayed dry by virtue of having saran wrap over the wound or simply avoiding getting the area wet while you shower other body parts. When you do take the dressing off at home, make sure that you're in the shower, soaking it off, not pulling rapidly on the skin or stretching it much as you try to get the dressing off. Sometimes the tape is not only adhered with its own adhesive, but it can also have glues that make it hard to take it off. Those are placed because we want the dressing to really stay on during those 3 prescribed days. Postoperatively, most patients don't have pain for about 3 to 4 hours because we use a lot of local, even when you've been asleep for an operation. But be prepared for it, because as the Novocaine wears off at 3.5 hours or so, then you may notice some discomfort. And so if you can go ahead and preemptively take some Tylenol and some Advil, if you're allowed to by virtue of your health, then that would be a good idea. The best way to do that is to put some food in your stomach as soon as you get home, and then take 2 Advil and 2 Tylenol, in other words, 4 total tablets when you have the food in your stomach to pad that. Take it at time 0, meaning right at that moment, mark that time, at time 4 hours, which is 4 hours later, and at time 8 hours, which is 4 hours after the last dose. So it's a total of 3 doses over a period of 8 hours, and that usually works, according to the pain specialists that talk to us about it, that usually works for stronger, really, than even codeine, but without weakening you out. Ice is always important. If you can be putting ice on a given area as soon as you get home as well, for about 15 minutes on and 45 minutes off, it does make a difference. Put a little tea towel over that place so that the ice is not resting directly on your skin, because it becomes painful, potentially damaging to your skin, and it's not necessary. You want to use the the ice, 15 minutes on, 45 minutes off, until about bedtime, and then have some next to your bed in case you need it during the night. There's other things you can be doing as well. If the operation is on your head and neck particularly, you want to avoid things like temperature hot soups that increase the circulation into your face and therefore cause bleeding. You want to stay away from spicy foods for 2 or 3 days for a similar reason. You want to hold off on doing major work, because as you stretch your muscles and do whatever it is that you do, you can easily tear sutures, and then it's difficult to restitch a wound that's been open, because now there's bacteria that want to grow down into the wound, and we don't want to trap them by restitching the area. So the best treatment is avoidance, so that you don't need treatment. You want to have gentle times at home. You don't want to open your mouth for a big bite of pizza. You don't want to be doing a lot of laughing or talking on the phone. So tissues can simply just relax. You can resume alcohol at about 4 days postoperatively. That does make a difference. If you notice any bleeding from an area, you can apply direct pressure to the area for 30 minutes by the clock, with fingers turning white as there's pressure applied to the area. After 30 minutes, the bleeding should certainly stop. And if it doesn't, then please call us, and we will explain things to you a little more, or see you, or do whatever it takes to help the problem. Increased pain, redness, swelling, those are all minor signs of having had surgery. You can also have individual stitches with tiny areas of red around each stitch, which is an appropriate reaction by your body's defense system to attack something foreign, which is a stitch, just as it would a splinter. Those are not worrisome. It's where the pain continues to increase more and more and more and doesn't relent in spite of the previously mentioned pain relieving medicines and in spite of the ice. Then you should call us. Also, if you can just not do a whole lot, then the 3 or 4 days post-op, that's going to help too, by not moving tissues around, allowing them to heal. Signs of infection are not usually fever and chills initially. It's usually the increasing pain, the increasing redness, which kind of forms in the entire zone of the area rather than around each individual stitch. If there's questions, of course, please feel free to call us. 707-579-9200. We wish you well and look forward to helping you in the future. If you have any questions or comments, please put them below. Tell your friends about this instructional video. If you want to leave a comment, if you want to share this with loved ones so that they can know what to expect after your surgery, all these are good things. If you would be kind enough to give us a like and even a subscription, it helps us continue videos like this of an instructional and educational nature for other people. Thanks for listening.